Hello and welcome. I hope everybody can hear me. Welcome to the KaVo Webinar with the topic Advantages of Microscopy in All Fields of Dentistry. Our lecturer today is our dentist Per Fossdal, and my name is Hanna Rambosek. Before we start, I would like to share with you some organizational information. This webinar runs via voice over IP. That means that you can see the presentation and hear the lecturer through your loudspeaker on the PC. During the presentation, you are welcome to ask questions with the chat. It is the Q&A section you will find either on the right side of the monitor or on the upper part in the monitor. It's a box that pops up and you can put in your questions. You're welcome to state your questions at any time. We will reach that there and Mr. Fossdal will be answering them live after or during the presentation. The webinar will be recorded, so that means that you will be able to find it and to view it at our homepage. And in case if you have any technical questions, don't hesitate to call our hotline on the number you see below. Now I would like to introduce Per Fossdal, who is our specialist here and will talk about this topic, better view, better treatment. Mr. Fossdal is originally from Oslo, Norway, and he's the expert witness of the Bavarian Chamber of Dentistry. Also, he has his own practice in Kempten in Germany. He is also the Vice President of the European Dental Association and specialist in implantology, reconstructive dentistry, and aesthetics, as well as function within the EDA. Last but not least, he's the General Manager of the Dental Working Circle in Kempten. Well, with this variety of experience, he became an expert in using microscopes, and now he will share some of this experience with us. Mr. Fossdal, it's your stage, and we're looking forward to hear your presentation.
Mrs. Rambosek, thank you very much for this very friendly introduction. Ladies and gentlemen, it's a pleasure to welcome you here to this webinar about microscopy, and I'm very happy that there are so many who want to have a better view on their area of work and to do a better treatment. Before I start, I just want to show you a couple of pictures of my home or where I grew up. This is the fjord part of Norway, the heart of the fjord part. It's a beautiful landscape, I think, and it's a pity that I'm not so very often there anymore. This is the small, very tiny village I grew up in, with about 300 inhabitants at that time. These are the houses of my parents. But now I'm living at the foothills of the Alps in southern Germany, which also is a very beautiful landscape, very similar to some parts of Norway. And this is the way it will look like in about 2-3 weeks when the dandelions are in full bloom, with yellow meadows and white mountains in the background. Well, that was a short trip to the landscapes where I've been living. Now we go to the microscope lecture. This is the first microscope I bought in 1997. It was a size up to 111, and it did a beautiful and fantastic job for many, many years. And it's really a new world when you start working with a microscope, and I can assure you it makes a lot of fun. Now, my favorite is this very elegant, small microscope of Leica, the M320, which, as you can see, is completely different constructed. It has no cables anymore. It's a smooth, very easy to clean surface. It's antibacterial, and it's very easy to handle. There are no fiber optics which can get destroyed or other cables. Now, why do you need a dental microscope in the first place? I think almost everybody has bought or is buying a microscope to do better endos, and so did I. But after a short time, and when I took a closer look at the areas I was working in, I really soon realized that there is far more to it than just endos. And so will you do when you buy your first microscope. A microscope, I use it to work more precise, and as I told you already, it makes my work a lot more interesting. It solves a lot of problems. It gives you a better view on the area you're working on and new visions on your work. It enables you to control your own work. It gives you, therefore, better results and more success in your office. And my experience is that patients are very interested in the work you do with a microscope, and they are also they would also pay more to get better work, to get more security in what you are doing. You need a microscope, of course, for better endodontics, and you need it for better examinations, which lead you to better diagnostics. But very often also for everyday work, like a better caries therapy, better fillings. I use it almost every time I'm doing a prep, not only for difficult preps, but every time. I use it for surgery and microsurgery, and also for better ergonomics, because my back is still okay after 40 years of dental treatment. I think you need a microscope with a camera, because then you have a better communication with your patients. You can instruct your patients better, and you can educate your assistants a lot better. And then you have better assistants when you're working, because they can see what you are doing all the time. If you've got a monitor to the camera, they can see what you're doing. They will be one step ahead of you all the time. And if you're giving courses, you need it for live surgery, demonstrations, and lectures. And what's very important, for documentation. I think nowadays patients are very quick to sue you if they are not satisfied with your work, and that's why documentation from the beginning on is so important. And of course you need a microscope because it makes fun to work with it. It opens a new world of dentistry. I'll just present to you here the small Leica M320. Here you've got the eyepiece, the binocular, which should be, in my opinion, 180-degree rotatable, because otherwise you would have to bend too much. It has got a lens for the fine adjustment, for the sharpness. And here you have the magnification adjustment from about 4 to 25 times magnification. Here you've got a button for the light intensity, and the light is really so bright that you very often have to turn it down a little. And here you can have yellow filtering, which you usually haven't got on your lamp or your operating lamp. And there is a small spot also for working with and doing endodontic work. Up here, an infrared sensor for the remote control, taking pictures and videos. As I said, the light is very bright because of a high performance LED bulb, a very long-lasting bulb, which you don't have to change for many, many years. And the yellow filtering, which make it possible to have a very bright light doing composite work or adhesive crowns or veneers or any light curing materials you're working with. Then you may also have an Ergon Optic Dent interface, which make it possible to sit straight and look straight ahead, and you can still look at your working area from the side. So you don't have to move your patient around from one side to another, or you don't have to bend yourself or twist to have a good view on the tooth you are treating. Here, some details. This is the SD card for taking photos. Here you can release the photos or videos manually. What is important when you buy a microscope? In my opinion, the 180 degrees rotatable eyepiece, I think that's mandatory, and the Ergon Optic Dent interface, so that you can really sit in a healthy position, take a healthy posture. And then one other thing, you should mount the microscope at the ceiling of one single dental unit. I know that most dentists buying a microscope for the first time want to have it movable, to move it from one room to another. And of course you do that in the beginning when you start to work with it. But after some time, it takes just too much time to move it. Your office may be too small, it's difficult to get through the door, and it takes some time to adjust it. So after some time, you don't move it anymore. And that's a pity. It's much easier to have it mounted at one single unit and you move the patient, which is much quicker. Then you should have it equipped with a good video camera, because without a video, it's only half the use, you have the advantage you have with a microscope. Without the camera, you cannot instruct your assistants, you can show anything to the patient. And when you have a camera, you also need a monitor so that you can, or your assistants can look at it. Now, what does microscopic magnification mean? If you imagine this is the way you look at it without magnification, and now we magnify it 16 times. It's quite a difference, isn't it? And you can see a lot more things you didn't without magnification. For example, here we've got caries here. This enamel area is not clean. Here you've got cracks in the enamel, and you have to remove caries here again and again. So it's really a lot better work if you use microscope. Where do I use it? And when do I use it? Of course, I started with endodontics, and I will not talk too much about endo because you know it's used there, but just show you one case. This was a young lady, about 20. She had a pulpitis in this upper 6. I opened it, and of course, in that age, you haven't got too much secondary denting. So I found the canals almost at once, but only two of the one of the mesial and the distobuccal canal. And the famous MB4 wasn't there at all. I tried to look for it, I didn't find it. Clean and shaped both canals, and then I went to the palatinal canal to finish it off, and all of a sudden I saw a small opening very close to the palatal canal, and that was the canal number 4. And then it wasn't difficult to clean and shape that either. So you can see, if I hadn't had a microscope, I would never have found this canal. It was just too close to the palatal canal to be looked for in that area. Of course, you also use the microscope for root resections, and if you break a file in the canal, sorry, I haven't got a picture of that, but if the canal is straight, you can remove almost every fragment of a broken file using the microscope. And that, of course, is a thing that shouldn't happen to anybody, but it did, or it still does, in a lot of offices. But if you use a microscope, it will not happen to you. I'm quite sure. And especially not things like I show here on the X-ray. I am maybe allowed to say that these are not patients of mine. When you place a post in a tooth, you can be sure, using the microscope, you can be sure that it will always be in the middle of the canal. You will always see the gutta percha, and there will be no danger for perforation at all. When I get a new patient and I see in the beginning that there's a lot to do, I give him a video eye monitor so that he can see what I'm seeing. He's doing the examination with me, and that's why it's very easy to convince someone who is perhaps a little stubborn or someone who knows everything better. For example, this patient here told me he was brushing his teeth 3 times a day. He didn't tell me, though, that it was only the front teeth and only on the outside. And he was just wondering why his teeth were jiggling and why he had such a bad smell of the smoke. So he was very, very quickly convinced that he should do a little more after losing half of his teeth. What do you think a patient thinks when he sees this picture here, or you see this through the microscope? He can very easily detect that the old amalgam filling is not good anymore. It's not more leakage proof, and it has been repaired already once. So he will decide to do something about it. This tooth will need a crown, and there will be no discussion of debating about that question. Or these wonderful fillings here will also be changed very rapidly, I think, if the patient had to decide. Or this fractured tooth. You can show the patient that the fracture is very deep, that the fragment has to, when the fragment is removed, you can't do anything more about his tooth. So it has to be extracted. You can really only treat what you can see. And we were for some week trying to treat this upper 7 and the distal aspect. There was a rather deep pocket there, and we were not able to remove all the calculus in the furcation. We thought it was calculus until I looked at it with a microscope and saw that there was an enamel pearl there. And as I removed that with a diamond, the pocket healed very quickly and the problem was solved. Or here, a lady came with a constant pain in her lower 6 on the right side, and it had just a very big old amalgam filling, which was removed. And after removing it, we could see that there was a lot of cracks in the tooth. Fixing it with a composite filling for some time as a temporary solution, the pain was gone, and we'll wait for about half a year to decide if she should make a crown or not. How would you treat a tooth like this? It's an upper 7 palatinal side. I think it's almost impossible to fill without almost lay on your patient. You can see directly, and you can never be sure that you have removed all of the carious tissue without having some loop or a microscope. This was also a lady with a telescope crown here and prosthesis, and she was very scared that she would lose her last tooth with the telescope, because then she would have a jiggling prosthesis. And I was able to find a gap here between tooth and crown and some weak tissue. I could remove it with a very small burr and save the tooth, I think, for years still. You can check your matrices. Of course, this picture is a little exaggerated. You haven't got that big gaps usually, but it's just as a demonstration what you can see. Because very often you squeeze the rubber dam between matrix and tooth, and you can't really see it without any magnification devices. It should look like this, and you can see this is leakage proof, and you can fill it without any more, without having to do anything else. Or modeling and carving fillings. I think it's very difficult to do a good filling because you have got the same color of tooth and the filling material of the composite. So that the three-dimensional form of a filling is not easy to see without any loops or microscope. And here I'm using my microscope every time. And I prefer it much more than the loop because I can sit straight and look straight ahead through the microscope. And so I have my back without, I can save my back for many years without pain. How would you treat the caries like this? This is the lower 7 mesial aspect. It's a small cavity, but it's in a very critical place on the tooth, very critical area, and you can see here is still caries. I couldn't detect that with my probe, but with a microscope it was easy to see, and so I could treat it properly. And as you can imagine, it's almost impossible to place a rubber dam here. So I fixed it with a wooden kind. The word is lacking for the moment. But I was able to see that the cavity was dry, and I could condition it properly and fill it, and I'm sure that that will last for many years as well. I'm always using, as I said, I'm always using the microscope when I do a crown preparation, and especially when I'm preparing for adhesive crowns, where you remove as little substance as possible. And at the end of the preparation, I prepared at very low speed and cooling it with air to get a smooth surface and a smooth bevel so that the technician can work very easy. When I work in the upper jaw, I like to use this spin bright mirror, which has a rotating mirror surface. It rotates with about 1500 rounds per minute, and so it spins the water and the debris away, and you have clear sight on the area you're working with all the time. And the more you work on the palatinal side of the mouth or oral side, the more important the microscope is, because you can, as I said, you can sit straight, work straight, and look straight ahead. As I said, checking all the preparations, checking the rubber dam with the microscope, checking the etching of the teeth. And I thought I had prepared this tooth very well and looked at it once with a bigger magnification and saw there were still caries at the initial aspect of this cavity. So I removed that, took an impression. I'm checking all the impressions with the microscope too. And when the crown is finished, I check that with the microscope also, like here. Usually, or earlier, I used spot indicators to check the crown. Now I do everything with the microscope, and it's much quicker and easier than doing spot impressions. And you can see there are some small discrepancies here and here, but they are very small, and I do one spot impression, correct it, and when you etch the crown and you etch the tooth, you lose about 4 micrometers anyway, so the crown will fit a little better afterwards. Then I'm checking the rubber dam, and I control the amount of etching. That's good, and you can see that everything is prepared only in the enamel. And of course, when the crown is luted, I remove the excess with also with the microscope, and you can be sure that you have got everything. Here again, another rubber dam control, or the check of the etching of some veneers, and again the impression. Now, I said already that documentation is getting more and more important, and you have to, first of all, you have to document the beginning of the work, the situation, before you started treatment, because that's a picture you never get back again. If you forget the last one, it's not so important. You can always do that again and again. And with a microscope, the camera is there all the time. You can make contact-free pictures without shaking. You will get the highest quality. You can take single pictures or videos, so you really don't need intraoral camera. And by the way, these are made with a reflex camera. These two were the first, and during treatment also reflex camera, and the last picture is made with a microscope. So I don't think you can see much difference. By the way, I think that you will have on your screens, you will not have quite as good pictures as we have here, because the pixels, it's more pixeled than when we take a picture with the camera. A lady came to me with a loose bridge and asked me to fix it again. And as I took it off, it was broken in 2 parts. And she said I had broken it. So I just took a picture with the microscope again and could show her that this bridge must have been loose and broken for months. And after that, there was no discussion. And so you can document a lot of similar treatments, similar things, and you are sure that you will not get any sue on this kind of treatment. During periodontal surgery, I also use the microscope, and I can control how well the tooth is clean. You see there are small parts of cartilage here and here, here, and a big one here. So they are then very easy to remove before I use Endodontics and close the surgery. Small sutures are very often difficult to remove if the patient waits too long to come to have them removed, and it may hurt quite a lot, but with the microscope you can remove them very easy without hurting the patient. Have you ever had broken implant screws? If not, you were quite lucky. Luckily, I had 3 up to now, and I was able to remove 2 with the help of a microscope. I could just loosen them with a probe, but on the 3rd one I used the ultrasonic device and thought I could get it out of them, but instead of that, it was welded to the implant, so I had to use a burr to get it out, and of course I damaged the implant a little. I confess I'm a microscope addict, and I'm afraid I infected my successor. He uses the microscope almost as much as I do, and he is instructing his assistants and telling them what's on, what this picture means, and using also the microscope for instructing his patients and getting better assistance, because your assistant, as he told you, they are looking at the picture at the monitor, and when you're working, they see how far you are in your treatment, and they will always be 1 step ahead. If you give courses, dental education and life surgery, you need a microscope so that you can show details in the oral cavity, and therefore you will get, or you can inform your students a lot better. Microscopes cover a wide area. We started with endos, and now we get to ergonomics. I think everybody knows this situation. You do a quick look at your patient and bend your body as far as possible just to have it, to see what you are doing. Of course, most colleagues nowadays are sitting when they are working, but still they have to bend and twist to see what they are doing. And the most important reason for bad postures and pain in back and neck and shoulders is that you want to see what you're doing, and that's really bad. So even if you sit like the ergonomists tell you to do, you have to turn your head a little to the left, a little to the right. And if you are sitting straight, you have two options. You may sit correctly and you cannot see anything, or you can see well and you will have a bad posture. So you need some kind of magnifying device. I started with a loop. Besides scaring my patient, I still had pain in my neck and in my back because I had to turn even more with loops than without. And as you can see, you want to have a direct sight on the area you're working in, also with loop on your head. Or even in this exciting position, you have to bend too much forwards to see what you're doing. Or when I'm doing some more coarse work or just polishing, I just push the microscope up and it's there all the time ahead of my face. I just have to fetch it and I can adjust it within 1 or 2 seconds. Working with the microscope means that you have an effortless way of sitting. You don't have to bend. You see everything you need in the complete oral cavity. If you want to look sideways, you can use the Ergon Optic Dent interface. And when you start with a new treatment, you adjust your microscope. If you just need it for a moment, you push it a little upwards. And if you need it again to look through it, you just push downwards or pull it downwards, and you can adjust it within a second. With a microscope, you will work a lot more in the 11 to 12 o'clock position, and I love to work with the front delivery unit. You pick up and return your instruments without even have to look at it. Like here. So I'm sorry, it was a little loud. So I just let the instruments fall back on the unit. I don't have to look where the next instrument is. And it's really a quick and clean way of working. I'm sorry if the video is not really running good on your monitor. It depends on the rate of pictures through internet. Are there any disadvantages with the microscope? Well, I can't find any. And I just want to show you one case I did last week. It was upper right 5. It is the man who has his mouth full of crowns. He's not brushing too well, and he has no money to fix them. But he is a nice guy, so I promised to try to save this tooth. Wasn't quite easy. I really wanted to do it without removing the crown, but when I looked at it, it wasn't possible. So I had to take out the crown, and that was what the tooth looked like. Removing all the caries, this is from another aspect. Removing all the caries, it looked like this. I managed to put on a rubber dam and looked at it from all sides. There was no perforation. The tooth was still vital. And then I filled it. I turned on the yellow filter, filled the tooth. It wasn't quite easy to get it filled everywhere and without any bubbles or empty spaces. And then it was prepared with some other positions. And then it was prepared and finished off. And I had a check on it 2 days ago, and it was still okay. There was no pain, and it's still vital. Okay, that's then the end of this lecture, and I hope I could give you any advices how to look at or work with a microscope. And I thank you very much for your kind attention.
Okay. Thank you very much, Mr. Fossdal. It was very interesting. Now I would like to ask the participants to ask some questions with the Q&A section, and I will read them to Mr. Fossdal, and he can answer right away. Okay, the first questions are coming in. First of all, Mr. Fossdal, what is the learning curve for the microscope?
Well, it will take about, of course it depends how often you are working with it. If it's just once a week, it will take a year. But if you're trying to use it most of the time, it will take about 1.5 to 2 months, and you will not miss it anymore. Wouldn't miss it.
Okay. Here is a question about the images. What is your experience comparing the Leica images with the Zeiss images?
The pictures.
The pictures, yes. Or the image that you get from the microscope?
Well, no, I must say my Zeiss microscope is an older model, and the pictures of the Leica are a lot better.
Mm-hmm. Another question, what is the return on invest? When does it pay off for you?
Well, as I said, there are a lot of patients who are willing to pay higher prices for safe and good work. So I couldn't really answer this question because I'm in Germany, I don't know where you are, and there are very different taxes for different work. So of course it will take some time to pay back in a microscope, but I think it's worthwhile doing it because it makes your work more interesting. It makes more fun, and the patient will be very happy about it.
Mm-hmm. Thank you. There is another question about disadvantages. We have seen many advantages, so again a question, what other disadvantages do I need to pay attention for? And isn't it like wearing eyeglasses when you don't really need them? Can you compare that?
Well, I'm wearing eyeglasses all the time, and that's not a problem at all because you can adjust your eyepiece to the eyeglasses you are wearing. If you have good eyeglasses, you have a neutral adjustment of your eyepiece. And I can see really see any disadvantages, except for it takes a little more time in the beginning when you're using it. But after that, I think you even save time on many fields.
Okay. What happens if the patient moves his head? So do you have to focus again, or how does it work for you?
Of course, they have to focus again when patients move their head. But it's really only a problem when you work in the lower jaw. Because when you close the mouth and open it again, you are out of focus. But then I just use a wedge, put it between the teeth, and the jaw is quiet, not moving. And as you know, if you try to tell a patient to move his head to the right, it will take about 20 seconds and he will keep his head straight again. They always tend to keep their head in the middle of the pillow and the middle of the seat they are or chair they are laying on. So they don't really go out of focus.
Okay. Another question, if you use the microscope all day long, or first question, every day and then all day long, is it possible or is it hard for you?
No, it's not hard. I think it's easier. It's easier, it's not hard. Of course, you don't use it all the time. I would say even if you use it during every treatment, you will work with the microscope about 50%, I should say. And of course, there's some technical work when you don't use it, but inside the oral cavity, about 50%.
Okay. Another question regarding the learning curve. Do you have any tips or tricks to maybe accelerate the learning curve?
Yes. If you, for example, do a filling on a upper, you should start with the upper 5 or 6 over the front tooth. And because it's easy to work in the upper jaw in the beginning and in the lower jaw. And then you should just you should mark, for example, the buccal cusp with some color, so that you always know where you are. Working with a mirror, turns everything around, and with this, when you mark it, you know exactly what you are doing, and then there you are with your instruments.
The next question is it possible or is it hard to work with the microscope in a higher magnification and at the same time using instruments without looking away from the microscope?
Yes, it's not a problem at all. The magnification doesn't influence the use of your instruments. Of course, if you're very high magnification, it might be difficult to keep your mirror quiet, for example, because you can see every beat of your heart in the mirror. It's shaking at every heartbeat. But except for that, it's not difficult.
So what about the assistants? Can she help you? Does she have to work differently when you work with a microscope? Because she needs to give you a better support maybe than without a microscope?
Well, a different support, because with a microscope, your angle of view is different. It comes from a head. How should I explain it? When you are looking at a picture of working with a microscope, I'll show you here. You see, I don't know, can you still see this?
Yes.
No?
Yes.
when you're looking through the microscope, you're looking straight ahead, and your view is coming from here. So the assistant has to know that you're not looking from here to here, but from the lens downwards. But that takes just one session, and they learn. That's not difficult, and it's very easy to explain, because if the fingers or the instruments of the assistants is in the light of the microscope, they will be in your field of vision. So they will always know when they are disturbing you in your work.
I think this is very interesting to keep the discussion here alive. So keep on putting any questions in. The next question is: we have talked a lot about the back, how good it is for your back and less strain and so on. What about the eyes? Is it a big effort for the eyes? Do they get fatigue? What is the combination with the microscope here?
No, it's on the contrary. It's better for the eyes to look through the microscope, because you look at a larger area. You don't have to concentrate and focus on very small details. And as I wasn't sure myself about this, I asked a very famous professor for what do you call it? For eye diseases, and he said no, he was working himself many hours a day with the microscopes, and it doesn't hurt or the eyes at all.
Okay. The next question is if there is a microscope with autofocus. Maybe I can answer that. There are two microscopes on the market so far with integrated autofocus. The one is from Leica, a head-mounted microscope that has an integrated autofocus, and the other microscope is from Zeiss. It's the Pro Ergon, also with integrated autofocus. But we have to say that both microscopes are combined with a higher investment than a regular microscope without autofocus. If you need any more information on that, I would ask you to email me this question, and I would give you more information about this. The next interesting question, Mr. Fossdal, is with a microscope and a rotating burr with water, the image on the microscope will be blurred. How do you cope with this water contamination?
Well, the microscope will not be contaminated. It's too far away. I have no problems with that. The bigger problem is that your mirror, and when you work in the upper jaw, you will always work with a mirror, will be contaminated and blurred. But as I told you, there was a picture of a rotating mirror I'm using quite a lot, and it centrifuges the water and the debris and dirt away.
Okay. How much maintenance is needed for the microscope? And what about calibration? Can you calibrate the microscope, or how do you do this?
I don't quite understand what you mean by calibration. There are no measuring devices in a microscope. You just know how big the magnification is when you turn this button, and you need perhaps service every second year, every fifth year. I couldn't really tell you, because it was since 1990 1997, I think I had service 2 times. We are really not very often out of order.
Okay. Yeah, I think this question was mainly regarding maintenance, and so this with the service answers already the question. Regarding calibration, from my perspective, if you're working with a microscope with integrated camera, there is a possibility to do wide setup calibration, and this is actually all you need, and this is not a problem with the integrated camera. Another interesting question: what are the differentiating features between microscopes and magnifying loops other than ergonomics?
Well, of course, the magnification of microscopes is a lot higher, or can be a lot higher if you wanted to. That's really the only difference I can see. A loop will have a maximum 7 to 8 times magnification, and the microscope up to 25.
Talking about magnification, so what kind of magnification would you use in what speciality? What's the main magnification factor you are working with?
10 times. 10 times magnified. Okay. But doing endos, very often also 20 times. Okay.
Yeah. I think this answers also the question with the loops, because this is a magnification factor that a loop cannot reach. A question also regarding Zeiss and Xenon. Do you have a comparison from the Leica and the Zeiss, also with the light LED versus Xenon?
Well, I still have a microscope with a xenon light, and it's not quite as good as this LED light. And of course, the bulb has to be changed sometimes, and it's also a question of price, which is about between 600 and 800 euros for a bulb, xenon bulb, in the one I have.
Okay. How do you see the palatinal side with the microscope lens far from patient's mouth?
With a mirror. The microscope is always exactly 25 centimeters from the area you're working with. Mine microscope. You can, of course, have other lenses so that it might be 30 or 35 centimeters.
Okay. And those pictures in your presentations, you're wearing glasses. Do you have to wear these glasses with the microscope? And what about presbyopia glasses? Do you need to use them with working with the microscope?
Well, I'm using presbyopia glasses, and but you don't have to. You can always adjust the ocular so that you can work without glasses. But when there's more than one doctor in the office, it's better to work with glasses and to have a neutral position of the or adjustment of the ocular or the eyepiece.
Maybe a little addition to that, the Leica microscope can be adjusted from -5 until +5 dioptries. So this is not a problem. The only case where you would use or really need to use the glasses is astigmatism. Just a little add-on on this. I do not see any other questions coming in, but I think that was already a very good amount of questions and interesting questions as well. In case you should come up with any more questions, don't hesitate to contacting me or Mrs. Natalia Lebedeva. You will see our emails on the next slide. This webinar was, of course, recorded, and as soon as the link is ready, you will be informed and you can download the link. We will also send you a questionnaire within the next days, and we would be very happy if you could answer and give us feedback regarding this webinar. It will help us to improve this webinar. It will also help us to bring other topics, to introduce our topics through the webinar. So we would really appreciate your feedback. And here now you see the two emails you can send your questions to, and we'll be happy to answer anytime. Okay, so thank you very much, Mr. Fossdal, and thank you also, dear participants, for your participation. It was a pleasure, and hope to have your clicks on our link and on the webinar as soon as it will be ready, and we wish you a great day. Goodbye.